tuning in to the Government of Newfoundland and Labrador's COVID-19 news conference. I'm Leslie Clark with the Department of Health and Community Services, and I'm the moderator for today's question and answer session. Joining us today are the Honourable Andrew Furey, Premier of Newfoundland and Labrador, who is joining us virtually from his district in Deer Lake, the Honourable John Haggie, Minister of Health and Community Services, and Dr. Janice Fitzgerald, Chief Medical Officer of Health. Please stand by. Our news conference will begin shortly. Premier Furey, please go ahead.
Thank you. Thank you all for joining us today for Newfoundland and Labrador's COVID-19 update for July 21st, 2021. It is a good day in the middle of the summer in Newfoundland and Labrador, as over 600,000 doses of the COVID-19 vaccine have been distributed in the arms of Newfoundlanders and Labradorians. That represents over 82% with first dose and over 43% now with second dose. Newfoundland and Labrador, we are moving in the right direction. I myself got my second dose yesterday here in the beautiful district of Humber, Grossmorn, and Rocky Harbour. And I can tell you, the first dose was Pfizer, the second dose was Moderna, and I couldn't feel better. It's a safe, hybrid way to do things. And I encourage everyone to get the vaccine when you can, regardless of the style. We are moving in the right direction, and that is partly, of course, because of science and the vaccine, but more importantly, because of each and every one of you and your efforts in getting the vaccine. It's one thing to have vaccines in vials, but it's more important to have them in arms. And it's because of the commitment of Newfoundlanders and Labradorians that we are at this place and looking forward even to the future with life after COVID-19, using vaccines as our primary defense. So I wanted to, on behalf of the panel here, thank each and every one of you for getting your vaccine. And for those who haven't, please look at the trend. It's encouraging to see the numbers increasing every single day in all age categories. Please do your part to help us get through to the next stage. With that, I'll turn it over to Dr. Fitzgerald for today's update.
Sits at 1,437. There have been no new recoveries since yesterday, leaving no active cases in the province and 49 active cases on ships in the province. There are 2 hospitalized as a result of COVID-19, both of whom are crew members on ships. A total of 164,538 people have been tested to date. While we have 49 active cases in the province related to ships, there's no risk to the community. The ship in the waters off Bay Bulls departed earlier today, and the ship in Conception Bay that was first announced on July 5th is scheduled to depart tomorrow. Having vessels arrive in the province is not unexpected given our geography and the province's position as a first port for many vessels sailing in the Atlantic Ocean. I want to again recognize and thank Eastern Health staff who have done a great job handling the situation above and beyond. We have also worked closely with the Public Health Agency of Canada, who have been managing the ships as they arrive in the province and will continue this work with the remaining ship offshore. Now that the third wave has ended in Canada and the risk is lower, we are able to stop, catch our breath, and make some improvements in our reporting processes. Effective tomorrow, we are transitioning from reporting the number of unique individuals tested to the total number of tests completed. Early on in the pandemic, these numbers were more or less on par with one another, but most, if not all, jurisdictions were reporting the number of individuals tested. Jurisdictions have now changed to reporting the total number of tests completed, which is a much better indicator for our surveillance purposes. As we move into the fourth week of Step 1 in our reopening plan, we continue to do well, both in epidemiology and vaccination rates. Canada is reporting less than 400 cases daily. Provincially, we have not seen any new cases as a result of travel in the past 2 weeks, aside from the cases that came from the vessels anchored outside our ports. In terms of vaccinations, approximately 42% of our eligible population has received 2 doses of their vaccine, and now that individuals can receive their second dose at a minimum of 28 days after their first dose, we anticipate that we will achieve 50% of our eligible population having received 2 doses of vaccine by next week. This is well ahead of our estimated timeline. Taking all these factors into consideration, and provided that we reach the fully vaccinated mark, which means 2 weeks have passed since the second dose, so 2 weeks past 50% of the population getting their second dose, we will be revising the mandatory mask policy. We anticipate we could reach this in the second week of August, provided the epidemiology remains stable in the province and across the country. At that time, masks will not be mandatory in most indoor public spaces. But this can only happen if we get our vaccination rates where they need to be. And this is where we need everyone to step up. If you haven't gotten your first dose, please book an appointment. If you have had your first dose of vaccine, please get your second. We need all age groups in all communities to get vaccinated. Across the country and around the world, outbreaks are occurring in those populations with lower vaccination rates. So we all have to work together to ensure our loved ones are protected, our communities are protected, and to get back to normal. Please get your COVID-19 vaccine. Go to your pharmacy, book an appointment through your regional health authority, or go to your physician. Please get both doses of your vaccine. 2 doses offers the best protection against COVID-19. When you do go to get your vaccine, please take the vaccine that you are offered. Do not delay receiving your second dose just to get the same vaccine you received for your first. The mRNA vaccines, Pfizer and Moderna, are interchangeable. Receiving a different vaccine for your second dose is safe and effective. The quicker we can get everyone fully vaccinated, the quicker we can get back to normal. As a recap for anyone just joining us, there are no new cases of COVID-19 today, and the total number of cases in our province is 1,437. We will have to learn to live with COVID. We will see cases in the future, but we will be able to deal with what comes our way if we control what we can. Make the choice to be vaccinated against COVID-19 to protect yourself and those around you. Get tested if you are showing any symptoms, and stay informed on current public health guidance. And hold fast, Newfoundland and Labrador. Thank you.
Well, thank you, Dr. Fitzgerald. I'll now turn things over to Minister Haggie for some brief comments. Minister Haggie.
Thank you very much, Premier. Thank you to everyone for joining us today. We are doing very well. 43% with dose 2. That seems to be the percentage now that everyone's focusing on. And now with the prospect of movement on masks, I think this is another incentive for those who haven't got shot 1 or shot 2 to do their best to remedy that and get the shot. As we see the epidemiology improving and our vaccination rates going up, we've also looked at another area that was very difficult for us in the beginning, which was the area of visiting in long-term care and also acute care facilities for the regional health authorities. That was difficult because it separated families and it separated loved ones. But effective Friday of this week, we will be going back to a slightly modified version only of what happened before COVID. So there will be screening measures at the entrance to the facilities. There will be a requirement for masks, and for those areas of the hospital where there's multiple occupancy, 2 or 4 bedded wards, there will need to be distancing between bubbles, but there will be no limit on the number or frequency of visits per day. This, I think, will work out quite nicely for the significant number of family and friends who are coming into the province from away, and hopefully will help deal with some of the distress and the need for support for people in acute care too. So again, a sign that things are going in the right direction, and yet further indication that good levels of vaccination will help us. Our seniors are very well vaccinated, and numbers-wise as high as 90-odd% in long-term care. To deal with one other issue which came up, and I thank the folk at Alderwood Retirement Home for raising this. This was the issue of dancing in personal care homes. It was never really our intent to restrict those once the vaccination levels rose, and certainly we've clarified that in an email to personal care homes today. I thank the Footloose fans for bringing it to my attention, and the offer for the dance card is great, but I'm no Patrick Swayze, so you will be sadly disappointed. The only other thing I'd mention before closing, Premier, is I think media have been notified and will be receiving phone calls. We'll be changing our written advisories to 3 times a week instead of daily, as long as the situation remains as stable as it is. I would simply close now by inviting everyone who hasn't had any shots to get their first, and for those who've passed the 28 days or 8 weeks, if you would prefer, on the basis of the science, to go and get their second, get the shot. It'll keep us all safe, as well as keeping each of us safe. So with that, Premier, I'll turn it back to you.
Well, thank you, Minister. You may be no Patrick Swayze, but I'm sure you're Kevin Bacon to many people across the province. So that's great news about allowing dancing in homes right now. Before I turn things over to the media, I did want to take this opportunity to thank the media for providing solid evidence across, disseminating it to Newfoundlanders and Labradorians. We've seen in other jurisdictions right now how misinformation can be a major barrier in getting vaccines, our best protection. And so on behalf of the panel, I wanted to thank the media outlets for doing their part in ensuring that the message being delivered is one based on science and is appropriate. So with that, I'll turn things over to the media for questions today.
Thank you, Premier. For the benefit of our speakers, we have 2 media in person and 2 joining by phone. The first round of the question and answer session will give each reporter the opportunity to ask 1 question and 1 follow-up. Following this, there will be a final round where each reporter will have the opportunity to ask 1 final question. Our first questions are from Kellyanne Roberts with NTV. Please go ahead and make your way to the mic.
Thank you. Dr. Fitzgerald, are you able to give us a bit more information about revising the mask mandate? So that'll be for all residents, not just those who are fully vaccinated, for example?
Yes, so the intention is that it's the order will be amended to remove the requirement for everybody. There will still be some situations where we will require masking. Certainly we're looking at long-term care facilities and other areas where we may have vulnerable populations, but And we still will highly recommend masking. It's just the question of whether it's mandatory or not. So, our recommendation certainly will be that if you, if you're in a situation where you don't know everybody's vaccination status, if you're not fully vaccinated, if you're around a lot of people you don't know, then certainly we would recommend wearing a mask in those situations. But for some other situations where you may feel more comfortable, where it's clear that the majority of people are vaccinated, then we would that mandatory having to wear a mask would not be there.
And as people learn to live with COVID-19 and have done their part to be fully vaccinated, taking the first dose that's available to them, many people looking to plan vacations now and try to see the other side of this. Many of those they're looking to get on cruises. They're not allowing people with mixed vaccines that are porting out of the U.S. though. Is there going to be an opportunity for people to potentially get a third shot that matches their first or second shot so they can continue to book?
Yeah, so I thought I'd read somewhere that there were some cruise lines that were accepting mixed vaccines, but certainly I'd have to follow up about that. But, the question right now with the mixed vaccines, certainly we know that travel within Canada will be quite fine. You will be okay when you come home. If you've got Pfizer, Moderna, or the other way around, you will not have to isolate. So those restrictions will not apply to you in that situation. I think as more and more information becomes available, and certainly, there are jurisdictions in the country that are looking at this and looking at response rates and looking at the effectiveness of mixed dose schedules. So as more and more of that information becomes available, I expect that that guidance will change. So I think as we'll see more in the future about that. But at this point, there are conversations. I know there are conversations that are happening. They are looking at the federal level. They are looking into this, but we have to leave it to them to be able to make those connections and to advocate in that way. With regard to the third dose, I think we'll have to wait and see what happens and what comes from all of that before we make that, a decision about that.
Thank you.
Our next questions are from Peter Cowan with CBC. Please go ahead and make your way to the mic.
Thank you. Dr. Fitzgerald, I want to ask about businesses or proof of vaccination for activities within the province. We've seen other places in the world, for example, Europe, if you want to get into a sporting event, you need to show proof of vaccination. Is there any plan to require that as we start opening up and allowing larger gatherings to happen? And with that, what about businesses who may decide on their own that they would like to do that for the comfort of the people who are around them? Should businesses be able, or can they require proof of vaccination in order to decide who's allowed into their facilities?
So from a provincial point of view, we are not going to require anyone to release personal health information, of which a vaccination status would be, to anyone. That is a person's right to decide if they want to do that. So to require it certainly would be infringing on that privacy. And so that's outside of a health situation, obviously. So with regard to whether businesses can do that or not, I'm not sure that I'm the right person to ask. That's really more of a legal question, and I'd had to defer to that. But so I don't know that I can actually fairly answer that.
And I want to ask about the opening of the border with the United States, which is set to come into effect probably about the same time we're set to drop the masking mandate. So do you have any concern that as we start opening up travel, especially with places like the United States where they still have large pockets, a lot more cases than we're seeing, do you have any concerns about the potential for even fully vaccinated people to bring COVID into the province?
The importation of COVID is always a concern. That's definitely true, and you're right. As the border opens, that is going to be a concern. I will say that to date, we have had people from the U.S. coming into the province because there are people who are allowed to enter the country. So of the travelers that we had, the vast majority have been fully vaccinated, in fact, and so, we anticipate as more people get vaccinated that trend will continue. So that is reassuring. Testing is available to anyone who develops symptoms. That's really important. So any traveler who's here, obviously if they develop symptoms, we would want them to get tested to find those cases as quickly as possible. Most of the travelers that we're seeing right now, I think, are visiting. So they're coming to visit somebody, whether it's friends or family in the province. And so, we're not seeing people, a lot of people out moving around indiscriminately. And so I think those are doable, that people would be able to comply with that. So, we're going to keep a close eye on things. Obviously, this is all depends on epidemiology, and if we have to respond, we will.
We will now go to the phone. Our next questions are from Peter Jackson with the Telegram. Please go ahead.
Thank you. You were just recently asked about the mixed doses, and I'm wondering if you feel the message is just not getting out. We hear anecdotally about a number of people going through and just refusing a second dose because it's a mixed dose. What efforts are you doing to try to mitigate that?
So certainly at the vaccination sites, the staff there are educating people as to the interchangeability of the vaccines and that it's safe and it's effective. In my understanding is that the number of people who have actually left is quite small. We have heard that there have been situations that has happened, but the number is actually fairly small compared to the number of people that have gotten the vaccine. So I don't anticipate it's that going to be that big of an issue. I think most people understand that the need to get vaccinated and to be fully vaccinated is the most important thing, and whether that's a mixed dose schedule or the same dose schedule, I think most people are happy to do what they have to do.
Okay, thank you. And I'm wondering, perhaps this is better addressed to the minister. It's become an issue in some places where people are worried about their loved ones who are in long-term care because they don't know what the percentage of healthcare workers and staff are actually vaccinated. Is there any way of getting those statistics? Because I know in some cases there is an alarming tendency among some people in healthcare not to get vaccinated.
That's a very good question, Peter. Certainly from influenza statistics, it's been surprising some years, and I'm not necessarily referring to Newfoundland and Labrador, but there have been very low percentages of vaccine uptake. I can get you the figures for healthcare workers in general. It will be a little bit difficult maybe to break them down into too many segments in terms of occupations or jobs, but certainly we can find that information out for you and we'll pass it along and share it to your colleagues.
Okay, thank you.
Our next questions are from Richard Duggan with VOCM. Please go ahead.
Thank you. A question about the 3 ships that are anchored off our province's shores. Our healthcare staff are the ones that are going on those ships to perform those tests. I was wondering if we know what the vaccination rates are among those on those ships.
So generally speaking, I can't speak to specifics of each ship, but generally speaking, the vaccinations, the crew members, the majority of crew members would not have been considered fully vaccinated. So that may be that some had vaccine but just hadn't gotten 2 weeks past or hadn't gotten a full schedule of vaccine. So generally speaking, the crew members were not fully vaccinated. Our healthcare staff are, however, fully vaccinated and took all precautions when they had to go on the ship. And of course, some of the assessments actually took place on shore. So the crew members came to the healthcare workers.
Okay, and we keep talking about the under 12 age group as a potential risk factor for spreading COVID as they can't yet be vaccinated. Dr. Fitzgerald, do you know of any studies that are ongoing about vaccinating those who are under 12, and is this something that we could soon potentially see happening?
So yes, both Pfizer and Moderna, is my understanding, have studies that are looking at the younger age groups, and some are, I think there's some that are looking at 6 to 12 and then 2 to 5. Those studies are a while out yet. I don't anticipate that we will have any information from those until sometime in the fall. Yeah, we won't, unfortunately, won't be able to vaccinate kids in that age group before school starts.
I will now go back through each reporter to see if you have one final question. Kellyanne Roberts with NTV. Do you have a final question?
Yes, we're seeing other jurisdictions do lotteries for those who have been vaccinated, knowing that our vaccination rate is extremely high in our province, looking at over 82% with first and over 43% for fully. Now with the mask mandate, looking to entice people to also, who haven't received their shot, to go and get it. Has the province looked at doing a lottery similar to what other provinces have?
Certainly, we're not entertaining that right now, Kellyanne. We've got great faith in the people of the province to continue to get vaccinated, and certainly that's not something that we're looking at this particular moment in time.
Thank you.
Peter Cowan with CBC. Do you have a final question?
I do. The overall rate is around 82%, but there are some age groups and even some genders, for example, where it's substantially lower. For example, if you look at 18 to 29-year-olds, 18 to 29-year-old men, it's only 63%. So there's still about a third that haven't gone out and gotten a first dose. So first of all, how concerned are you that there are some age groups where we're not seeing those numbers rise very quickly? And what are we doing to try and reach out and make sure that some of those people who haven't gotten it do get it?
Thanks, Peter. That's a good question. You know, obviously, I would love to see 80% plus fully vaccinated in every age group, in every community in this province. So, you know, that's what our ultimate goal is. We recognize that, you know, people being people, that may not always be achievable, but certainly we would like to see that number rise in that age group, in the 20 to 29-year-olds in particular. We would like to see an increase in the number of first doses, and certainly it appears that the ones who have gotten their first doses are eager enough to get their second, that those numbers are rising. But you know, there is certainly a little bit of concern with that for sure. So the regional health authorities have developed plans, and we're seeing in Western Health, for example, they have started walk-in clinics as well as Lab Grenfell, and that seems to be fairly successful with getting people in. We know that convenience is really important, and especially in this age group. So we're certainly trying to do clinics where you know, that age group may spend some time. And I think in Eastern Health and Central, they're planning the same sorts of things, as well as we'll call them pop-up clinics, which makes them sound very quick and easy to do. But I will tell you that trying to plan a vaccination clinic is not, it's a logistical challenge and a logistical feat. You know, we call them pop-up clinics, but they take a lot of planning at the same time. So we are certainly looking at, you know, where can we go to try to reach the greatest number of people and to in those age groups. So those are plans that are in the works. We're going to be continuing to vaccinate throughout the summer and into the fall. You know, just because we get to a point where we hit 80% doesn't mean that we're going to stop. We want to get as many people vaccinated as possible, and anyone who wants to be vaccinated, we want to vaccinate them. So.
Peter Jackson with the Telegram. Do you have a final question?
Just one quick question for Dr. Hagen. I don't know if it may seem irrelevant, but I'm wondering if you still have to get a TB test in order to work in the service industries such as restaurants and bars.
I would not have the same level of detail about that for private businesses as, for example, DGSNL. I do know that TB tests are required for nursing and medical students. I couldn't speak to private business. I think Minister Stoodley's department may be the best people to advise you on service industries.
Okay, thank you.
Richard Duggan with VOCM. Do you have a final question?
Yes. For the revised mask mandate, would this include schools, considering that under 12 can't be vaccinated yet?
So our goals with schools is, for September is to have children to be able to go back to school to as normal a situation as possible, which would include not masking. Conversations are ongoing. We're having discussions, and we've met with Education and School District to have these discussions, and certainly we are working through those plans now. But our goal is really to have this school year to be as normal as possible.
Thank you.
Thank you, everyone. Premier, do you have any final comments for today?
Well, thank you all for joining us today. Certainly continues to be positive rays of hope after a long 18 months or so. So please do your part. Get vaccinated. The trends are encouraging, even in some of the demographics that have lower absolute percentages. The trends are moving in the right direction. So look at your peers, see what they're doing, and please continue to get vaccinated. As Dr. Fitzgerald and I are both evidence of mixed dosing is good. I've got Pfizer and Moderna. It's safe, it's appropriate, it's scientifically based. This is something that the international community in terms of travel will definitely figure out. As I'm sure everyone's aware, the Prime Minister has one dose of AstraZeneca and another dose of something else. So this will be sorted out in time. The most important thing to do is to get your second dose as soon as you can so that we can get back to as normal as we possibly can and live with COVID-19. So thank you all for joining us today.
Thank you, Premier. Stay safe, everyone. Take care of yourselves and each other, and enjoy the rest of your day.
This is Jan. Jan sometimes visits her neighbor Paul. Paul has COVID-19, but doesn't know it. Jan also takes the bus. So does Mo, who's a frontline worker. So if Paul infected Jan, Jan could infect Mo, who could infect a lot of people. But wait, they all have the COVID Alert app. So Paul tested positive and entered a code in his app, which anonymously alerted Jan. So Jan stayed home and Mo went to work safely. Phew, close call. Help break the chain of infection. A message from the Government of Canada.